Good morning, everyone. Hello there. It's always an extreme pleasure to be with each and every one of you, and I just can't praise you guys enough for taking this down the road and really helping people. And so I know I'm a little behind here. Thank God I got so much behind me that from here on I've got a lot of time to shoot some videos. So appreciate you hanging in there. And I just have to first thank so many people. This is actually not from Yaz. This is from Jody Barber. Beautiful card. Jody, sorry about that. They'd stuck Yaz's stuff in here, so I apologize for that. But I just love that flower. It's gorgeous. And I appreciate this. Bound for Idaho. Look what I've got. Honey, honey, honey. Honey, thank you. Oh my God. Nectar of the friggin' gods. If I wasn't sucking down this fresh squeezed orange juice, you know, according to our friend in Switzerland, they have better oranges. I don't know about that. They probably are from Spain. Thank you for the cards, the lovely cards that you're sending. Thank you so much. My heart is open. And this is from our Bound from Idaho. Love the son. I guess he does like to draw guns. Appreciate what that came into. And she sent me this. And everyone, I have a lot of these. Everyone should have this. That's in America. The U.S. Constitution. And you should read it. Particularly Article 1, Section 9, Clause 4. Which forbids direct taxation of private citizens and the like, which is what the IRS has been violating everyone's constitutional rights. And that's never been overturned or amended. Supreme Court has upheld that over and over and over from Bushhaber on. And, everybody should know the Constitution, and therefore you know your rights. No matter what laws or what, that ranks supreme. All right, I've got to take off on this because so many of you have so many great questions. And those from the Facebook, I want to get to you guys here with a lot of your questions on detox, for sure, and Girl Gone Vegan. Listen, Kelly, this is seeing sediment. Woohoo, this is great. You asked me about cervical headaches. This is all about the lymph again, although you can tweak the C-spine and you can get anything from trigeminal neuralgia to everything else, C2 areas and the like. So absolutely, this is still all about the lymph, even though it's location, 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 and what the pressure does, the resulting effect in the cerebellum, all of this sort of thing. It's going back to the same old stuff here. But I want to get to this question from this Lisa from Chicago, because she's asked several times and it's buried in these questions. And I've been involved in a big move and everything, as you know, and it's kind of held me back from getting to you all. So I apologize immensely, but we're going to take off from here. So let's look at this. This is from Lisa. 1. For people trying to pull tumors from the liver, what are the ways in which people expel them? I am using this protocol for tumors and so far have thrown up some black mucus. Wow. There's also sulfur coming out. Wow. Oh, I love that. So if you have tumors in the liver, would the closest exit be via the mouth? Well, you know what? I've never thought of that. I've never seen liver tumors come up through the mouth, ever. The way we do them is through the channel of the lymph, which is where the tumors are in the first place. And so generally it's, the body opens them up as they close them. As they isolate this fluid, it also opens this up and drains this fluid through the lymph nodes and then out the kidneys, which is real close to the liver on the right side. So it's just right there, to come out. To regurgitate it up through the mouth there, I would think you would have to definitely vomit it up, and you would have to really yank and pull up through there. I don't think it's going to come back up through the sphincters and come back up this way. That could be coming from the stomach itself, and that would, you could also, if you were having liver tumors, you would also have, keep in mind the liver and the pancreas is just branches of the tree of the GI tract. And so remember, when the lymph system's backed up, it's backed up head to toe. This is the problem. This concept that cancer moves on you like some mysterious diseases is just a ploy to keep the people from killing, I suppose, MDs for using chemo. You know, and this thing on the news that, oh, we're in shortage of chemo and the kids are dying because of lack of chemo. FDA, please step in and tell the truth of what percentage of kids survive chemo. Please, come on, tell the truth to the people as you know it. You know, this is they make it like, oh, here's a wonder drug, it's curing people, and we can't get it, and that's bullcrap. That whole lie, that whole festering lie, that's going to cave in on them one of these days, I'll tell you. And then they show this little kid walking down the hall with no hair on, like walking down a slaughterhouse. I'm telling you what, these guys are so narcissistic. I believe they believe that. I believe they believe in themselves like that. And it's like chemo, the juice, Jesus juice. That sends me out the roof there. Or some tumors broken down into small particles and released via the bowels. That's possible. That definitely is possible. It is possible to see that coming out of the stools. I've seen pieces of liver from a liver flush coming out of the stool as well. And this is the thing, is these liver flushes, don't overdo them. I mean, don't overdo some things. Some people are having trouble because they've overdone liver flushes, and it's like, what are you trying to do? Keep spasming the liver. You know, if you pop out a few stones, okay, but then go after the lymph, because remember, the liver is just a bunch of cells and two major fluids, even though it's a redundant issue. So I've had a lot of nausea this past month. Well, that's why I'm saying this is probably coming out of your stomach. Some of this black mucus and stuff. Very common to see that in the stomach wall there, to have very black putrid matter coming out of the stomach. Seen it in several stomach cancer cases and the like. So this person, whoever's doing this, is extremely toxic, no question about it. But by the time you're mutating cells from their own acids, intracellular acidosis, you're pretty toxic. Because there is protection of the cell with phospholipids, with the HDL in the cell wall. There's protection, and the fluid itself is somewhat of a protection, since the lymph is a lipid-based fluid. So there is some protection there, but after a while, you know, and so when sewage starts building up for years, now some of the young people, the cells are already coming in atypical. It doesn't take much to throw them over the top. So you're seeing, you know, quite a lot of cancer in just a few months old category. I'm not sure if we'll continue with the nausea until all tumors are released. Well, first of all, I'd like to know what you're doing to get rid of liver tumors, like an internal black salve, like Canex or something you're taking down that way to help pull that out. But you always want to get the kidneys and the lymph and the kidneys and the adrenals going on this. This is real important, because that's your true channel. And it's just not about liver tumors, it's about the lymph system in the whole body. So this is really, you need to focus on the kidneys and the lymph and the adrenal glands and the GI tract all simultaneously while you're doing this. You'll be a lot more successful. But I like the fact that you're getting up the black mucus and stuff. That's pretty good. These herbs are strong, and I like that. There's a couple of good black sap type formulas out there on the market that's Native American and stuff that are really good. So yeah, I mean, excellent. Number 2, is the CT scan the only way to find out if my tumors are diminishing? You can try an ultrasound and see if you can determine through the ultrasound. You should be able to determine that through an ultrasound. I would do an ultrasound way before a CT scan, particularly if you've already had one. I remember one lady, we used to do one every 6 months. It was aggressive lung cancer, and I never could get the cancer out of her lungs. But I had her at 74, and she died at 86. And she didn't die of lung cancer, but I couldn't get the tumors out. But boy, she had a full life, buried her husband and her dog. So, it's just, you can still have tumors in you and live for years and years and years and years. But get them out, because this reflects the lymphatic system. This isn't a disease that medical doctors are chasing down the road. This is simply a backed up sewer system. And if it's backed up and you've got liver tumors, you've got heavy lymphatic problems in the gut wall, stomach, GI tract, small and large bowels, probably in the pancreas as well. Not uncommon. Your whole lymph system's backed up there. I had a cheat day and had very little discomfort in my liver compared to, oh, this is probably you we're talking about, honey. Discomfort in my liver compared to pain that I used to have. Well, you're getting it. You're getting it, sweetheart. It sounds like you're getting it quite well. Keep up especially the grape fast for liver tumors. Excellent for that. I've really not seen too many liver cancer cases that couldn't overcome it. I've always thought liver cancer wasn't a difficult cancer, neither is pancreatic. Very few people we've ever had that came into our health programs ever died from pancreatic cancer, except those that couldn't do the program or freaked out and did. You know, when you really sift through the cases, those that could not make and survive when they wake up to a diagnosis of cancer are those that decided to treat it allopathically, or those that couldn't do it all the way naturopathically. And those are the ones that, you know, and those that it's time to go, you know, and sometimes it's time to go. But in your case, sounds like you're cleaning this up and you're getting this quite done. Also, my right kidney did not have any pain. Good deal. Very little discomfort. See how you're getting it, and that's how you tell. Oh, look, my kidney doesn't hurt so much. Oh, look, I cheated and my liver didn't retaliate. Yeah, you're getting it. And that's a, you know, it's a small little way of telling, but it is a good way of telling, because this is how your body starts getting better and better and better. And as your body gets better and better and better, the discomforts go away. And when you cheat, that's when it slaps you the hardest. And when you can cheat and don't have a problem. This is how we test our diabetes and everything else. Go out and have a piece of cake. Go ahead and have these things. Let's check your blood sugar. How's your body regulating blood sugar? You know, and so we test it on the job. We want to shake you and see how well you're doing. And so a healthy body is a healthy body. End of story. There's no conditions that men would have left after that. I wanted to see how my body would react with a cheat day. Oh, that's a good way to do it. That's exactly a good way to test it. Exactly. I've been eating oranges, melons, apples this past month. I cannot find good grapes. Well, you're doing good. Thank you, honey. I think you're kicking butt. This is why Fabu Lisa. Good job, sweetheart. Kicking butt, dear one. Kicking butt. Now, I've been requested by the YouTube site. Let me see. Do you prefer red or green grapes? Kelly, the red is stronger than the green. If a person has constant under-eye puffiness, is that related to the kidneys? Absolutely. And you know, as you get your kidneys online, you notice how your puffiness goes away. You know, anybody's got bags under the eyes, as they start getting the kidneys in a healthy state, you notice the bags start disappearing? Absolutely. Absolutely. I've got to find this. Chris handed me this. Esophageal gastric mucosa ectoptic. What the hell? I'm curious about this condition, what causes it, and how to treat it naturally. Well, I wouldn't treat it. This is Ms. Super Mini. Move those lymph. That's exactly what it is. Mucosa is part of the lymph system. It deals with, of course, the acid side of chemistry there. So what's esophageal tissue made of? What's any tissue made of? Cells. And whenever you find the cells, what do you find?